Hello, I'm Lyndsey Hookway. I'm a paediatric nurse, health visitor, international board certified lactation consultant and gentle sleep coach. And this short video should help you to position your baby for a pain-free feed at the breast. There is probably nothing more demoralising when you're trying desperately hard to breastfeed your baby than to be experiencing pain due to poor positioning and attachment. So I cannot stress enough that this video is not intended to be a substitute for quality face-to-face breastfeeding counselling. So if you're in pain, please get help. There is loads of free help around, drop-in clinics, breastfeeding groups, baby cafes. Please keep asking your midwife or your health visitor until you get yourself pain-free. And there are also loads of really good websites, so try kellymom.com for some really good information. But while you wait for that help to come, this is just supposed to give you a few ideas about how to potentially get your baby positioned in a pain-free way. Okay, so the first thing to do is to allow your breast to hang in its natural angle, and we'll come back to all of these points in more detail in a little while. You also need to hold your baby really close with their head and body in a straight line. You need to have your hand around the base of your baby's neck, almost if you imagine reaching out to grab a vase or a pint glass or something, and that's the position that your hand needs to be in, around the base of your baby's neck and supporting their shoulders and back. And your thumb and your fingers need to be roughly where a necklace would be, around the base of your baby's neck if he were wearing one. And then we'll talk a little bit more about why it's recommended to position your baby nose to nipple, because loads of women are really confused about this point. And then a lot of times people are really surprised by how close you need to hug your baby in close to you when they tip their head back and open really wide. But let's just now go through these steps slowly and one by one. So if your baby is due a feed anytime soon, go ahead and put this on pause, go grab your baby, and I'll try and walk you through it. So the first thing to do is to work with your natural breast position. So most of us do not have nipples that stick out right in front of us. So it probably won't work to have your baby at a 90-degree angle to your body unless your breast is positioned in such a way that your nipple naturally sticks out right in front of you. So you can see in the photo on the left-hand side, this baby is at a 90-degree angle to the mother's body, but actually her breast is pointing down at about a 45-degree angle towards the floor, which is really, really common. And you can see that if your baby is in this sort of position, that actually they're going to take the nipple into the corner of their mouth, you're going to get extremely sore, and your baby won't be able to feed effectively. They'll probably fuss and pull off and arch their back, and they may start to hit you, and it's all because they're just not comfortable. If you have a look at the picture on the right hand side, again there's nothing different about the angle of the breast, but actually this time the baby is positioned in line with the angle of the breast. So for a lot of women that means that you need to rotate your baby slightly more on their back so that they're looking a little more up at you. And what this means is that they're much more comfortable, and that nipple will go into the safe part at the back of the baby's mouth, rather than them chewing your nipple in the corner of their mouth, which is exceptionally painful. And one of the reasons this is so important is that your baby needs to have their head and body in a line when they feed. So if you have a look at the picture on the left hand side, this baby has their head to the side, and in the same way that you need to have your head and body in a straight line when you have a drink, your baby needs to do the same thing. So it's extremely difficult to swallow when your head is turned towards the side. And that's one of the main reasons why it's really important to make sure that your baby is comfortable and that your baby is positioned in line with the angle of your breast. You can see that the baby on the right hand side is positioned with their head and body in a line. It'll be much more easy for that baby to tip their head back and swallow and stay on the breast calmly for a comfortable feed. So the next thing you need to make sure that you do is to keep your hand away from the back of your baby's head. It's really instinctive for most people to want to try and support the back of their baby's head, but actually when your baby is breastfeeding, that will disrupt some of the natural reflexes that they have to feed. So it's actually a really common cause of babies beginning to cry and fuss when they're positioned for breastfeeding if they've had an experience of somebody trying to push them from the back of their head. So try and trust that your baby actually can support their own head, providing you're supporting them along their spine and around the back of their shoulders and their neck. So you need to make sure that little head is free, because you've probably noticed that your baby quite likes to bob their head around, a little bit like a woodpecker, and this is a really important reflex for feeding, and it enables your baby to get a really deep asymmetric attachment on the breast, which is going to keep you very comfortable while your baby's feeding. So the other thing that confuses people is the nose to nipple concept. And I think the main reason people get confused is that, of course, babies don't feed out of their nose. And this really needs to be explained, I think, because women like to understand why they're being told to do something. And the reason that nose to nipple is recommended is that babies, of course, don't feed out of their nose, but they smell with their nose. And when they smell the milk at your breast, what they're going to do is engage all of those normal feeding reflexes, one of which is to tip that little head back. And so if you hold your finger out in front of your nose right now and then tip your head back as if you were going to take a deep drink of water from a glass, actually what you'll notice is that your finger started off opposite your nose, but when your head tips back, it's actually right underneath your upper lip. And that's exactly what your baby's going to do when they're positioned nose to nipple at your breast. They're going to tip their head back, and then all of a sudden they won't be nose to nipple anymore. They'll be upper lip to nipple, but it will have changed the angle completely so that they end up coming to the breast chin first, and they will get a really deep, big mouthful. And you can test this out for yourself, because if you put your finger opposite your mouth with your head in a normal position, and then you put your finger straight into your mouth, the first thing you're going to touch is your tongue. And if you put your finger opposite your nose and then tip your head back and then put your finger straight in your mouth, the first thing you touch is the soft palate at the very back of your mouth. And that's exactly what the baby is going to try and do when he's positioned in that nose to nipple orientation. So you can see in the photo that once that baby is positioned nose to nipple, what he's going to do is tip his head back, and he will at the same time open his mouth really wide, because that's part of that feeding reflex. Babies tend not to open their mouths really wide if the nipple is right in front of their mouth and all they have to do is sort of hoover it in. So babies will generally only open wide if they really have to stretch for it. So nose to nipple, your baby will tip their head back, and then when you see that actually your nipple is now opposite their top lip and their chin is going to be the first thing touching your breast, then you hug him in really, really close and very, very quickly. And this is the bit that takes a little bit of bravery, especially if you have been sore, because actually the faster and the closer that you do this, the less likely you're going to be in pain. But that does take a little bit of guts. So once you've hugged your baby in, what you're going to see is that your baby has their chin deeply indenting your breast. So you won't be able to see that chin if your baby is on properly. And also their nose will be free to breathe because they have come to the breast chin first with their head tilted back, which means that their nose is free to breathe, which is handy because they need to be able to breathe as well as feed. So this is a perfect design. And in the early days, good attachment doesn't necessarily mean you'll feel nothing, and it doesn't mean that you'll be completely pain-free. Sometimes it can feel a very intense, strong pulling sensation. And if you do have nipple damage already due to poor positioning, it's a little bit like if you walk into a table and bruise your leg. Every single time you touch that bruise for a few days afterwards, it's going to smart, it's going to throb, it's going to hurt. It's not because you're doing any more damage to your leg, it's just because you're touching that area of soreness. And exactly the same thing happens on your nipple. If you've got nipple damage and bruising, every single time your baby breastfeeds, it is going to feel quite a strong sensation, but most women can tell the difference between a really unpleasant grating sensation, which is caused by poor positioning, and just a very strong pull on an old wound. The difference is quite easy for most women to tell. The other thing that you might notice is that when your milk begins to let down under the influence of oxytocin, which is the hormone that squeezes the milk out of your breasts, that can cause a sort of cramping and prickling sensation. It can feel like a tingling, shooting sort of feeling as the milk begins to come out of your nipple. And this is quite usual. And it will settle down over the next few days. It tends to be more pronounced when your breasts are very full. So do try to feed your baby frequently so that your breasts don't get too full and uncomfortable. It's also normal to need to take a few deep breaths at the beginning of the feed and to need to just concentrate for a little while. And that's all because actually this is just a new sensation for you. And in the same way that one of the first symptoms of pregnancy is tender breasts and sore nipples, when you first have your baby, the hormones of breastfeeding in the early days make you extremely sensitive to your baby's suckling on your breasts, because most women aren't used to this sensation. So it might just take you a few days to get used to that, but it is very short-lived. And if you are experiencing extreme pain that isn't normal, please be reassured that you do not have to put up with immense pain. So to reiterate, it is never ever normal to be in toe curling pain, to not be able to speak while you're feeding. That's not normal. If you're cracked, bleeding, sore to the point where you're dreading feeds, none of that is normal, and please get help for it. What you should be able to see when your baby has a good attachment at the breast is that you should see lovely full rounded cheeks, almost like a little hamster. Your baby shouldn't have any dimpling in their cheeks as they suckle, because that will tell you that they haven't got enough breast tissue in their mouth. So you should see full rounded cheeks. You shouldn't be able to see your baby's chin. They should have come on with their chin leading, so that their chin will be buried into your breast. And your baby should want to stay on the breast until they finish their feed without pulling off. If they're fussing and arching their back and hitting and pulling off, that's usually a sign that they're uncomfortable in some way. And the usual reason for that is that the positioning needs to be improved a little bit. Or moving rhythmically. So check the video on how to know my baby's getting enough. to understand a little bit more about suckling patterns. You might even hear some swallows if you're in a very quiet room, but try not to get obsessed about looking for swallows or listening for swallows, because that can just drive you crazy. Instead, try and watch for your baby actively using their jaw and rhythmically suckling and seeming quite content on the breast. I hope that's helped you understand how to position your baby for a pain-free feed. Thanks for watching.